Hi, everybody. Welcome to GW Center for Integrative Medicine and Dr. Kogan's personal YouTube channel. Special guest today. Anna Furman is my long-term friend and senior Alexander Technique teacher. So that's what we're going to talk about. We're going to talk about what is Alexander Technique, what it's used for. One of my by far favorite methods for a variety of chronic pain, for low back pain, for neck pain, for any back pain, actually, frankly, for headaches, and for lots of, even for things like nausea and for anything structural where the functionality of the posture is not good. So we'll get into the detail as to what exactly Alexander Technique is in a second, but I do want to say that I've seen Anna work. Unfortunately, she's not in our area. She lives in Boston, so we can't really bring her in and out frequently. But without further ado, Anna, in 2 words, what is Alexander Technique?
Alexander Technique is a method of teaching an understanding of our body, how we use ourselves, how we position ourselves, how we relate in parts in our body, and how it affects what we do, how we do it, and what habitual problems we occur throughout the year due to our line of business, or like what we do, or if we had any injuries or surgeries or whatnot, and how we cope with that. So,
I know that you've had a pretty interesting personal story, just like many of us doing this healing work. We have our own personal stories. So tell us, like, how did you end up choosing this technique as your professional career?
well, in sitting, you probably can't tell that I'm 6 feet tall. I became my height when I was when I was 14. So it was like not an easy journey as a teenager. And I think for the most part, my my scoliosis in youth that no longer with me, kind of roots there. The habitual way of hiding myself, of trying to be shorter, trying to be, of the height of my classmates. And I carried it with me throughout life, without knowing, without thinking, way past high school. So I found Alexander Technique actually through Misha here when we were discussing chronic shoulder pain and how it kind of shoots, every time that I go through any type of like cold or like minor soreness or like anything else, like immediately it goes into a very specific area in my body. And he said, well, why don't you go and look at it? I think Alexander Technique is a very interesting method, and that might actually be something that will help you. That was 12 years ago?
Something like that.
Maybe. Yeah. Since then, I practiced Alexander. I came first as a client. I found my teacher many years ago as a client because I was trying to get rid of the chronic back pain. I was trying to figure out how to improve my breathing because I was, routing my shoulders, and I knew that my performance in running and skiing and any type of sport was affected. So that was that, and never looked back.
So yeah, and so the way the Alexander Technique uncovered to me, I've had a couple of personal sessions. That's the way before I met you from Xenia, which is Angela's co-acupuncturist back many years ago. She was practicing it. So I did some sessions with her, and then in 2007, I want to say, maybe it was a little bit later, I can't remember exact date, there was a very high-grade, very high-quality study published in British Medical Journal. It's kind of similar to JAMA or New England Journal of Medicine in Europe, showing that 9 sessions of Alexander Technique did better for chronic back pain than combination of massage and physical therapy. And it was a lot better, and it was way cheaper and a lot less sessions in total. So I kind of, wow. And in England, Alexander Technique is covered by their standard
not just in England,
system.
Many, like most of the European countries.
Most of the European countries. So I think we should show to our listeners what it looks like.
Sure.
I know I have a lot of problems with my posture. You always try to correct me, but let's just do it. So I'm relatively healthy. I don't have a lot of problems, but I do have neck pain periodically, especially sitting long on a computer. So we felt like that the best way to really describe what Alexander Technique is you just showing.
Yep.
And you just walk through me and show to our listeners sort of what am I habitual postural problems, and how can I be more aware of them?
Absolutely. Sending the hips forward, and that's usually has to do with the fact that the shoulders are rounded very slightly, because we're trying to adjust and be balanced up above our feet. So the moment that we send our hips forward, we disbalance and we're trying to compensate it elsewhere. Easiest compensation can be found in our shoulders. So for the most part, people who are, who are trying to figure out what's going on with their, what's wrong with their postures, most of them will find that their hips are slightly forward and their shoulders are slightly rounded. And as a result, most of them will have a problem of the head sending back and down. And that's where the Alexander begins.
And I totally personally agree with this, because especially most of my tension when I work or when I don't move enough and I don't do my yoga start feeling right here, this whole area.
In Alexander, we work with the recognition of force of habit, and this is usually, new directions usually start with the connection of the head, neck, back. So sending the head forward and up in relation to the rest of the body. I'm going to stand so you can actually see Michael. So to allow your neck to be free, to allow your head to go forward and up, aiming up with the crown of the head and lengthening through the back of the neck. This alone usually kind of invites the elongation of the torso. If we add a slight shift in the hips and trying to find the balance up above our feet, almost like in people who practice Qigong or yoga or any of that, it's this neutral stand when the weight of the body is distributed at the feet and the head is aiming up and the rest of the body is kind of distributed evenly. So the person finds itself in a position when he's not or her is not holding anywhere. Usually that frees up the knees and the hips.
So I feel more tension, I have to hold here more.
All right, so when we elongate in the torso, we not just elongate in the back, we also elongate in the soft tissue of the belly. So the elongation happens from the pubic bone through the soft tissue of the belly to the costal arch, through the chest. And in the back, it goes through the back, between the shoulder blades, and there. So the activation of the corset zone is required for this to happen, because the moment that you soften the belly, you kind of let yourself slouch and
definitely
and,
feel a lot more stable here.
and that immediately
More
affects affects what happened at the top. So this is in a very, very simple beginning kind of understanding of what the Alexander is all about.
And you're really showing the client not only you literally make them feel this.
Yes, absolutely.
In a real life.
Absolutely.
Exactly
the lesson requires physical contact and verbal direction. So when I work with my clients, it's both physical touch along with the verbal direction. I usually explain why and what we do.
And you will do this in any position. They may
Yes,
be
absolutely.
sitting on a computer.
Yeah.
Maybe they're
This
playing the
is
instrument.
this is the beginning. This is a very kind of step square one to where we start. From here, we usually will go into moving. If you would start bending the knees forward and away from yourself, just start bending the knees. And make sure that you keep the hips balanced up above, because it's very easy to bend the knees and let the hips to go forward. And what happened, you immediately starting holding in the knees. So lengthening in the torso as you do so, and start bending the knees to go into a little squat. And keep the hips back, and keep the hips back, and keep the hips back. See, so even in the squat, you still super balance up above your feet, and then from here, you can go to whatever, in Alexander, we call it position of mechanical advantage. So from here, if we're talking about sports, you can jump, you can start running, you can hoop, you can do anything you want. With arms, equally, the balance of the body, the elongation of the torso supports the freedom of the shoulders, because if we don't, for the most part, again, we will tend to tense in the shoulder, and then the freedom of the arm is being impacted. So the moment that the elongation of the body is there and the shoulders are free, then the long or the short movement of the arms is supported. So most of the people who will come in with frozen shoulders or problems with their elbows, most of the time it has to do with the fact that the neck is tense and the back is not supporting the limbs. And we work from there. And yes, absolutely, we will work with what the person does for the occupation. If it's something, if it's being in front of a laptop all day, and that has to do with how the person sits, how the head is positioned.
So
And
you would work through all that
Yes.
in several sessions and kind of a personalized program.
Usually, it's always personalized. It's always one-on-one. I do offer classes, but it usually is either introduction or collaboration on a specific topic. For instance, I will run a workshop for yogis. So I will collaborate with a yoga teacher and her group of students, and we will take one set and take it literally apart, looking at it through the Alexander eyes and seeing how the motions, how the asanas are built, and what it meant, for the person and how to do it better.
So it's actually a good point, right? So the original therapy evolved from the performance.
Yes.
Right? So, and you were just telling me before we were recording this that every art school teaches this, which I was
In
surprised.
Boston area, most of the performing arts schools will have Alexander technique as a semester, as a semester course.
So just to improve the artists'
To improve their performance, to make sure that they understand how their body is operating, I see a lot of people with vocal problems that actually lives in the fact that their neck is compressed. And the moment that
they
you
can't
change,
project.
they project, but they project by forcing, not by actually projecting.
So
And
they strain.
they strain their vocal cords, and that's actually how the founder of the technique started it. He was reciting from the stage, and he lost his voice, and he couldn't figure out what's going on with him. And then by practicing and trying to figure out what exactly he does when he performs, he found out that he actually projects through this, and he impacts his vocal locks and impacts the vocal cords. And then from there, it's all evolved into a much bigger, nowadays Alexander technique performing art world is only like a small portion of what Alexander technique is.
So let's talk about this for a few minutes. So I know you've been telling me about some of the amazing work you were doing in Parkinson's disease. Tell us a little bit more about that and any other medical problems you've seen this can benefit.
Parkinson is actually one of the areas where most study been done. There are many different very good articles and very good studies that the early stage of Parkinson, because it's neurological, because people losing in Parkinson, what happened, people losing the cognitive ability to direct certain motions. Alexander can help to teach how to move again almost like through a parallel pattern, to build a new pattern of how to move the arm if the person has a habitual way that been impacted by the disease, and most people that's how they do, and they can't do that. And you can actually see that in Parkinson you can work with people and teach them how they can direct themselves into the motion in a new way, and that builds almost like a new circuit, and it works.
Amazing.
And it's incredible.
So what other conditions are you commonly seeing?
Scoliosis. A lot of time people most common is headaches, all sorts of all the panel of headaches, from just headaches to chronic migraines. Because while migraine has different, you as a doctor know that you have different types of migraines, but most of the migraines, they actually has to do with the tension in the neck. So the moment that we tense the neck, the headache or the tension in the head appears. So the person I was talking about when we were talking about this recording, he came to me with chronic migraines, and now being with me, through series of lessons, he actually says that not that the number of the migraine cases is reduced, but also he knows now how to recognize the kind of approaching of a possibility of a migraine and what to do, how to change the use of the body, what kind of exercise to do to kind of shoo it away.
Yeah,
and a lot of time it works.
We're definitely gonna publish this case.
Yes.
So definitely Alexander technique can fix the sort of the postural aspect. But you also were telling me the pregnancy and just
Yeah, if you can think of it, for women especially when they're pregnant, it changes how the baby grows. The impact on the spinal column changes, and the position of how we carry the baby changes, throughout the pregnancy. And the further we do, the bigger the belly became, and the more we carry it in the pelvis and the lumbar zone, and that's where the sciatica and the pain in the lower back starts and lives. And a lot of time people, women say that even after the labor, the sciatica stays with them for many years, if not forever. And changing this and knowing how to balance better and how to distribute this weight of the belly better in the body, and later after having a baby, actually carrying the baby and still being, because especially when they very, very young, when we nurse, when we carry them around, it's part of us. It's part of how we carry them around. So like knowing how to distribute it a lot of times saves a lot of pains and aches.
Well, before we wrap up, I have one very personal topic to touch upon. We kind of often joke that longevity depends on your back, right? It's not actually a joke. It's partially very true. And like I see in my parents, my father is beginning to kind of hunch forward, and everybody knows, right? Like in an 8th, 9th, and 10th decade of life, this happens. So I wish that every single 65-year-old had a course with you, so just to get, at least to get a sense of how do you maintain the posture. Any recommendation for anybody over 65? Like they're thinking that they may be starting to stoop forward, and what can they do without finding a teacher?
A lot of what I see, people as they age, they're less sure in their feet. So part of this is this almost like mental need to check where they step instead of seeing where they go. So, and a lot of the elder people, you probably see this as a doctor, when the elder people trying to find their slippers, that's how they, or like trying to reach for something, that's how they tumble off the bed, that's how they tumble off the chair.
Right.
Because this idea that they actually need to roll and crawl to see has to do with if the vision, if the eyesight is getting lower, but also that they're less sure on their feet. Right. So the ability to be more active on their feet for sure, but also finding the balancing exercise. There is
balancing exercise.
There are many different great blocks of balancing exercise. There are simple ones, there are long, there are long ones, there are short ones. There are like do this 2 exercises every day and you'll be great. If we're talking through Alexander, like my favorite one, especially for people who are still very good on their feet, if you can find this balance that I just demonstrated with Michael, that we find the balance on the feet, we elongate through the torso, and then we bend the knee lightly and stay on the toe of one foot and rebalance again, almost coming to the point that this leg is not bearing any weight. And if you feel comfortable, you can lift it up without actually shifting and trying to catch yourself into the hip and coming back. And again, bend the knee, roll the toe, stay there. You can go back, change again. If you feel comfortable, lift the foot. This is very simple. This is something that everybody can do, not just elderly people, but this is a very good balancing exercise, and it really provokes the body to kind of realign, and you don't have to go look for it.
Well, thank you, Anna. This was very, very opening for me, even though you've done this on me before. If you're in Boston area, check out Anna's practice. Of course, we'll have links there. We'll try to bring it to DC area, but it's not easy to fly people in and out.
Of course, I'm open. Like if you have any questions, you can shoot me an email. You can reach out. I'll be glad to.
And we'll put some more links. Like we'll put some more links to what Alexander Techniques and like the formal certification institute there. So thank you very much.
Thank you guys.
Have a safe one. Take care. See you soon.